Osteoporosis physical therapy, worse exercises for seniors. When you have osteoporosis and have low bone density, some exercise is beneficial. However, not all forms of exercise are beneficial. The thing is, you not only should stay active if you have osteoporosis, your bones actually require it. Osteoporosis is a condition in which the body loses or produces insufficient bone tissue, causing your bones to become brittle, weak, and prone to breaking. Inflammatory arthritis may also increase your risk of developing osteoporosis. Contrary to popular belief, certain types of exercise can help prevent and manage osteoporosis. According to science, low-impact weight-bearing exercises help build and maintain bone strength. Muscle strengthening exercises provide the same benefit. Using free weights, elastic bands, or your own body weight strengthens muscles and aids in bone density maintenance. However, not all exercises are appropriate or safe for people with osteoporosis. Osteoporosis Foundation, certain activities and movements can increase your risk of fracture. Some high-impact activities may place an undue strain on relatively weak bones. Sports associated with a high risk of falling are also prohibited. Some high-impact activities may place an undue strain on relatively weak bones. Sports associated with a high risk of falling are also prohibited. Other activities to avoid include exercises that require you to bend forward and twist your waist, which can increase your risk of spinal compression fractures. Always consult with your doctor about which types of exercise are best and safe for you, and which you should avoid or at least modify. If you work with a personal trainer or physical therapist, use the nonprofit American Bone Health's list of questions to determine whether the exercise program they're designing for you is safe. Before we proceed with the video, physical therapy, worst exercises for seniors with osteoporosis. For more information, please subscribe to our channel. Caring for it together. Thanks. In this video, you can learn more about the physical activities you should avoid if you have low bone density or osteoporosis. Worse exercise, high impact. Weight-bearing aerobic activities such as running strengthen and slow bone loss in your legs, hips, and lower spine. And pounding the pavement on a jog or run increases the stress on your bones, providing additional strengthening benefits. Running, on the other hand, can cause injury or fracture if your bones are weak from osteoporosis. According to the NOF, power walking and brisk walking are much safer and nearly as effective. Worse exercise, jumping. Consider jumping rope, jumping jacks, or any other exercise that requires that sudden and explosive loading or impact when your feet hit the ground. Avoid jerky, quick movements as well, say Mayo Clinic experts. Instead, choose exercises with slow, controlled movements. Worse exercise, toe touches and sit-ups. Both of these exercises require you to bend forward, which puts strain on the joints in your spine, known as vertebrae. Whether you have osteoporosis or not, the front of each vertebrae is always weaker, says Chemis. She explains that if your bones are healthy, that portion is still less dense, but the vertebrae are strong enough to tolerate forward movement. However, if you have low bone density and apply a lot of force or pressure to the front of your spine, such as in a sit-up or toe touch, you increase your risk of a compression fracture. According to Chemis, a single compression fracture can set off a cascade of fractures in the spine. Compression fractures can cause back pain, but they frequently do not. Take the pain spot test to see if your back pain is the result of an osteoporosis-related compression fracture. Worse exercise, poses from yoga and Pilates. Yoga and Pilates are both beneficial in that they improve strength, balance, and flexibility, all of which can aid in the prevention of falls. However, certain poses or movements can put strain on the spine and put fragile bones at risk of fracture. You should avoid the following if you have low bone density or osteoporosis. Rounding poses or rounded spine movements, spine twist or any deep twists. Corkscrew or bike. Deep hip stretches, warrior pose, teacher pressure. Some yoga and Pilates movements, such as the tree pose and plank, are considered safe. A physical therapist can assist you in recommending or modifying moves that are both safe and appropriate for you. Worse exercise, tennis and golf. When you swing a club or racket, the forceful twist at the waist can put extra strain on the joints and discs in your spine, potentially resulting in fracture. Consider yourself behind the wheel of your car, attempting to back out of a parking spot, says Chemis. You're twisting around to get a better look over your shoulder. At some point, the muscles and ligaments are pulled to their limit, she explains. If you push it any further, the bone will have to bear the strain. If the bone is weak, it may not be able to withstand the strain. The same can be said for golf and tennis. She warns that rotating to the very end of your range of motion may endanger your bones. 3 women with osteoporosis sustained compression fractures in their spines while golfing, according to a case study. Activities that pose a high risk of falling should be avoided. Worse exercise, skiing and high-risk activities. Hitting the slopes increases the risk of falling, and falls are where the majority of fractures occur, according to chemis. Ice skating, rollerblading, and any contact sport are also on the list, according to chemis. Should osteoporosis patients avoid all of these exercises? No, not always. The amount of impact that is dangerous or which activities should always be avoided depends on your fracture history, the severity of your osteoporosis, and your overall health. It's important to be very conservative with exercise if someone has had a fracture in the spine without major trauma, says chemis. However, if you are generally fit and strong despite having osteoporosis, you may be able to engage in slightly higher impact exercise than a frail person. There is no one-size-fits-all exercise regimen. Consult your doctor if you are unsure about the state of your bones. Your doctor or physical therapist can advise you on the safest activities for you.